News from the state where we bring you a report on key development across Nigeria's 36 states. We begin in Gombe State where the Nigerian Medical Association has flagged a free healthcare service at the Federal Medical Center in Kumo, Gombe State. The two-day program is part of the week-long medical week celebration of the Gombe State branch of the association. Larry Adeyemi has details.
The crowded main gate of the Federal Medical Center Kumo tells a clear story. A people in dire need of critical medical care that they cannot afford. Inside, the tents are fully occupied with eager people desperate for care. After brief ceremonial speeches to flag off the outreach, the doctors, supported by other personnel, got to work. Managing the crowd was a challenge, but the joy of helping those in need make it worthwhile.
We usually do this every year, and is in a bid to extend healthcare to people who will be very difficult to access them, and to also increase awareness among the people to know places that they could have gone to get this kind of care.
Doing it here will have a large impact because this is a new hospital and the people are in need of these services. So bringing it here is like bringing tertiary services by different specialties to the doorstep of common man.
Beyond the organizers, the huge turnout shows the existing gaps in Gombe State healthcare system. So much more needs to be done as many people remain underserved. For those here, they are grateful.
I came to take medication. We are
happy with what the doctors has done by giving us drugs on hypertension, hepatitis. Altogether, we are very happy.
I really appreciate.
I have collected the medicine. I have BP, I have muscle pain.
It is a full week of activities for the Nigerian Medical Association and the doctors that the association represents. But this medical outreach helping thousands of people in this rural community certainly is the most impactful. Landry Adeyemi, TVC News, Kumo, Gombe State.
Senior reporter Larry Adeyemi joins me from Gombe State. Larry, thank you for joining us at this time. Talk to us about how critical this service provided by the Medical Association is and what gap they're really trying to fill here.
Thank you very much, Alamede. Such a pleasure to be here again. Okay, so the Nigerian Medical Association does this every year, the Gombe State branch, is because they know that there's a huge gap. Yes, the government has invested so much in the health sector, both the state and the federal government, but there's a huge gap. In a population of about 5 million, the doctor to patient ratio is still well over 2,000 persons to a doctor. And in many communities, the primary care centers probably just have one doctor who has to treat maybe more than 4,000 people. So the medical association often goes to some of these communities to render free medical care because another thing is specialist services. A general physician, a family physician, taking care of surgeries, pediatric issues, gynecological issues. So when these people go out with consultants, with specialists, orthopedic surgeons, and so they can treat more patients and refer some of them have their special needs to larger hospitals. So it's a partnership between this association and the government. They're trying to bridge the gap where the government is falling short.
Who are the major, beneficiaries of this? Looking at, your report, we understand that there was a large crowd, but are they prioritizing care? Are there areas of specialty being, addressed here?
Oh, almost everyone who goes for this free medical care are indigent people, really, because the most vulnerable members of society are the ones that try to take advantage of this, because the really wealthy ones would not even bother to attend. So the doctors have to attend to every single person who goes there because every one of them needs it. So let's look at the demography. They went to a rural community where the maybe average income is below 30,000 naira a month. So these people really need this free medical care because they simply just cannot afford it. In many government hospitals, even where some of the medication are free and some of the consultations are free, these people cannot afford the prescriptions. They can't afford the surgeries. So every form of specialty was available, from the surgeons to the pediatric doctors to the orthopedic doctors to gynecologists and so they were all there yesterday because all of these specialties are represented by NMA. But generally to speak and to buttress this, the people in the rural communities simply don't have a choice. And this healthcare outreach is just a life-saving measure to many of them.
Thank you very much for that update. That's senior reporter Larry Adeyemi live for us in Gombe.